as officials step up efforts to contain an outbreak of cholera. The capital has been battling the deadly virus since earlier this week.
Efforts to tackle Zimbabwe's deadliest cholera outbreak in a decade are being ramped up, as aid agencies deploy more volunteers and police place a ban on public gatherings in the capital, Harare. Around 4,000 people are infected with the disease, which has already killed over 24 people, and forced the country to declare a health emergency.
I'm experiencing a runny stomach with vomiting. I'm very weak with a headache, and I'm also bleeding.
The crisis is a test for the new Zimbabwean government of President Emerson Mnangagwa, under pressure to rebuild a country emerging from 4 decades of rule under Robert Mugabe. The finance minister, Mthuli Ncube, announced an emergency crowdfund on social media to raise money to fight the outbreak, but it sparked a backlash, with some users swiftly condemning the plan as an insult to taxpayers. National and local politicians are trading blame over a failure to maintain safe water supplies and maintain infrastructure. For many residents in the capital, the threat of cholera remains high amid signs the disease could spread outside Harare.
There's a cholera outbreak here, and the borehole that we've been using has been closed down, leaving us with no source of fresh water. We have no choice, but we might end up looking for water in those affected areas, and that way it'll be difficult to prevent more deaths.
Officials are desperate not to have a repeat of 2008, when an outbreak left 4,000 people dead and 40,000 others needing treatment.
In international news,